Acid reflux or heartburn is a high carbohydrate condition. And yes, your doctor is wrong in treating you with proton pump inhibitors. Please allow me to explain. My name is Dr. Ennin, doctorate pharmacist and a functional medicine doctor. And again, welcome to the channel. Today, we are going to be talking about acid reflux. So what is acid reflux? It's simply when the content of the stomach comes inside of our mouth. Now, God designed the body such that our stomach remains acidic between a pH of 1 and 3. So we want good amount of acid in the stomach and we want it to be very acidic. Now, when the stomach is that acidic and has good amount of stomach acid, there is a sphincter or a muscle band here that closes up. And once that is closed, the content of the stomach doesn't come inside our mouth. It acts as a barrier between the esophagus and the stomach. So we want low stomach pH and good amount of acidity. We don't want low stomach acid. So anytime you have low stomach acid, it can cause this LES or the sphincter to open up and cause the contents to come out. So we want good acidity between a pH of 1 and 3, and we want good amount of acid in there. An alkaline environment in the stomach, a low stomach pH will cause this to relax and open up, and that is not what we want, and that can be a problem. Now, the stomach is made up of endothelial layers called the columnar cells. Those are tall cells that are able to handle the acidity of the stomach. The esophagus on the other side has squamous cells that doesn't handle acidity that well. So in other words, we don't want to be putting a lot of acidic stuff down our throat. It can be a problem because when you continually do that, we change the endothelial layer of the esophagus from the squamous cell to a columnar cell, and that is another condition called the Barrett syndrome, and that's not what we're going to be talking about. So in other words, we don't want a lot of acidity going down our throat, and that is why people using apple cider vinegar is only for short-term purpose. Yes, we can use it on our salad and all those things, but we are not supposed to be drinking down our throat acidic stuff because that changes the dynamics of the layers, and that can be a problem because the esophagus is not designed to be dealing with acidity like that. So that is just the distinction between the lining of the esophagus and the lining of the stomach. A lot of things can cause this to relax. For example, we need potassium, we need zinc, we need vitamin C, among other things, to make the acidity of the stomach, which is the HCl or the hydrochloric acid. So all those things are needed to make the stomach acidic. But the primary cause of a lot of issues with stomach acid has to do with the chronic intake, the chronic consumption of carbohydrates. Because when we ingest carbohydrates, it goes inside our small intestine. When it gets undigested or it's not digested well, it goes inside our colon and it's fermented. And this fermentation process produces a lot of gas. And this gas causes the sphincter to relax. And once the sphincter is relaxed, we have regurgitation of the content of the stomach coming inside our mouth. And not just that, once we produce this gas, it triggers the release of two other hormones, the cholecystokinin and the glucagon-like peptide 1. So the cholecystokinin, which is CKK for short, and the glucagon-like peptide is the GLP-1 agonist. So the body is able to release these two hormones, and these two hormones also relaxes the sphincter, and that causes the content to rise up. And that is why when people are taking the Ozempic and the Trulicity, those are all GLP agonists, we have that side effect of acid reflux. Very, very important that we understand that. So like I said, there are other issues, some of them mechanical, like hiatal hernia, that can cause acid reflux, but those has to be dealt with by way of surgery. But primarily, a lot of people with low stomach acid and all those issues with acidity is because of the chronic consumption of carbohydrates. Now, most doctors are giving us the proton pump inhibitors such as the Prilosec or omeprazole or the Protonic or pantoprazole or the H2 agonist like the famotidine. These are to come inside our stomach to decrease the acidity there. Keep in mind, we want acidity in the stomach. Without our stomach being acidic, we are unable to break down the food that we eat. So we want good amount of acid and we want low stomach pH. We don't want the stomach to be alkaline because in an alkaline environment, this thing relaxes, the sphincter opens up, the contents come inside our mouth, and that's not what we want. So we don't want an alkaline stomach. We want acidic stomach, and we want good amount of acidity. That is why when we have low stomach acid, it can cause the relaxation or the opening of the sphincter. We don't want that. And we want acidity to be between the pH of 1 and 3. Those are the two things we want in the stomach for this to work right. So the proton pump inhibitors or the H2 agonists, such as the antagonists, such as the famotidine they go to decrease the stomach acid. And that is why when we are taking all the proton pump inhibitors, we tend to see a lot of side effects. One of the biggest one is osteoporosis, which is the bone loss. It's because we are unable to absorb calcium from our diet. Not just that, we're able to have issues with our gut, like colon cancer long term. Now, originally, when these proton pump inhibitors were designed, they were not supposed to be used more than 6 months. In this dispensation right now, people are using it consistently and have used it for years, and that can be a problem long term. So we want to be mindful, and we want to appreciate the biochemistry, the biology that goes on with this stuff. We want to understand what is happening when we are taking in this across our face, whether it's diet, whether it's the medication. So your doctor giving you proton pump inhibitor is the wrong approach. It's supposed to be used for short-term courses and not beyond 6 months. So acid reflux, heartburn, or gastroesophageal reflux are all because of our chronic consumption of carbohydrates. And that is why when people switch to the keto diet, to the low carb diet, to the carnivore diet, their acid reflux is gone. In practice, we have a lot of people who come in primarily as diabetics wanting true green foods. Keep in mind, most diabetics have decreased gastric emptying, meaning that the food sitting in their stomach for a long time is unable to churn, they're unable to work on it. So once they switch to low carbohydrate meal, they start benefiting from not just the low carbohydrate meal intake by helping their sugar levels, but their heartburn is fixed, because as a side effect of diabetes, they have the decreased gastric emptying, which causes acid reflux. So they switch to low carbohydrate diet. Not only are they helping their diabetes by way of their glucose, but they are also fixing the acid reflux. We see that in clinical practice all the time. So chronic carbohydrate intake may be the reason for your acid reflux. I hope this helps. Please don't forget to like, and don't forget to share, and most importantly, don't forget to subscribe. I'll see you in the next video. Thank you.